Working in Epic can be kind of like peeling a clove of garlic. If you're not really well versed in cooking, you might start by peeling off the skin with your fingernails, and it takes 5 minutes to do one little clove. And then someone might teach you a trick, and suddenly you know you can smash that clove of garlic with a knife, and then the peel just comes right off. Or better yet, you can learn that they sell peeled garlic in the grocery store, and you just do that, and that's like the most efficient, most wonderful way to do it. So Epic is the same way. We know from our data that people doing the same tasks and the same specialties take very different amounts of time to do them in Epic. And what we're doing to help support you in this problem is helping to bring everybody up to speed on what the best tips and tricks are to make you as efficient and simple as possible in your use of Epic. This intervention is called the Summit Program. Specialized Epic trainers will come to you and work with your specific clinical practice to help you with the things you most commonly get frustrated by and make you super fast and speedy in how you use it. This week, I met with Dr. Ahmed Naiem, a vascular surgeon at UCSF, so you don't have to take it from me because he's going to tell you about his experience of the Summit Program.
I'm Ahmed Naiem. I'm a vascular surgeon at UCSF. Going through formal training through summits that allowed me to, first of all, develop a framework where I could basically devote all my time during the clinical encounter to my patient, and then know that at the end of it I can go turn on my computer and just fill in those pieces of the puzzle without actually worrying about maybe not being fully attentive to my patient's concerns. And then more importantly, it allowed me to be much more efficient in the time spent on the screen. So I have definitely taken much less work home, and that allowed me to spend much more quality time with my kids. So it's been great. I think the onboarding training felt more like walking into an open buffet where you just get a huge load of information and too much info in very short time that perhaps doesn't really stick. You don't really remember much of it. This was personalized. This was dedicated to getting me more efficient through my issues, like my specific concerns as it relates to how I care for my patients. So this was like a Michelin star experience as opposed to a buffet. I spent more than 2 hours a day after work documenting and writing notes at least 2 or 3 nights a week. And after going through having this organized framework, I would say I do that maybe once every 2 weeks now, or once every 10 days. So, quite good. I envision the way in which I meet my patients in clinic as being a personalized encounter. Perhaps, I learn something very important about that person and they learn something important about me. The more I spend time with the patients, the more difficult it is for me to start to document what I need to document about that encounter on the computer. And that's sort of eroded into the time I wanted to devote to my patients, or even my attention. And I met one of the very, very delightful person who came in actually, and she allowed me to explain how I actually conduct my clinic. And then she actually made a list of things that seemed to be useful. And we sat on Epic on the computer, and she actually showed me how to develop templates for my clinic, number one, develop templates for the orders that I want to place on patients, and obviously templates for the kind of surgeries that I usually do. And that really cut time from all the navigation and just digging deep within tabs and layers of Epic that was really causing me so much discomfort. So It's been great. I did a 40-minute thing because I needed to go back to the OR, but we were supposed to do an hour, In fact, I'm actually signed up for a next session in 2 weeks' time to do a bit of more work on my inpatient documentation now. Number one, I'm not being paid to do this video, so I'm actually doing it because I think it was very important. It definitely changed how, I interact with the EMR. I think people who find themselves not being able to balance their screen time and their patient encounters time should sign up for it. It's an hour. It's shorter than most of our meetings, and it actually makes you much more efficient. And for people like me who don't want to take work home, want to try to disconnect and spend some quality time with loved ones, I found it very useful. I think the one thing that was useful and made it much more informative for me was to just think of the most recurrent problematic scenario I face in my clinic encounters and just describe it to the trainer. And so I see patients with specific circulation problems to the legs very frequently, and they usually require a set of investigations related to their blood flow to the legs, and also related to quantifying the risks of undergoing surgery and having to navigate through those tests and ordering them and putting indications and specific times and so on was just too annoying for me. And developing a workflow made it much easier with a click of button. Actually, it has my last name. It has peripheral arterial disease Naiem. So I just click it and it just, comes up as a prompt. Exactly. So it was very useful. If you're spending less time and less bandwidth thinking of your documentation, you can spend more time speaking to the person who is, giving you the trust to take care of them.
Attending physicians at UCSF Health are eligible for the Summit program. Find it in your email by searching for Summit or check out the One Good Thing newsletter. You will get QR views for your time.